All right, we are back with Cone Health's Chief Infection Prevention Medical Director, Dr. Cynthia Snyder. She's answering your COVID-related questions. This person says, can you give pets COVID if you have it?
You know, I don't think that's the case, but I'm not totally sure.
Okay, that is good to know. All right, so then this next question is, who is eligible for the monoclonal treatments?
So the monoclonal treatments, they're not as conveniently to get as they were in the past because a little bit of a national shortage. However, just depending on your risk factors for severe disease, the monoclonal clinics evaluate you to see if you would be a candidate to receive it. And then if not, there are also other options. We have some oral antiviral medications that we can give out. So it's really important that if you have like diabetes, heart disease, lung disease, if you're overweight or have like immunocompromised illnesses, all that is super important to let your physician know that if you want to be considered for receiving a monoclonal infusion.
Okay. This person is asking, how can I tell the difference between a common cold, COVID, or whatever?
You know, that I wish I had an answer to that that would say yes or no, but there's a lot of overlap. And I think some of the delayed, diagnostics we have, or in the sense that we think that's allergies, and then it ends up being COVID. So the best thing is to get tested.
So if you wake up with a sore throat, you wake up with a cough, you start having all this drainage, you think to yourself, it's better to just do an at-home test and just find out right then and there. That's going to be your best bet.
Yeah, and even if your test is negative with the at-home test, making sure you should wear your mask wherever you go. And the key thing is that you may consider to go on ahead to getting a PCR test, since that tends to be a little bit more sensitive.
Okay, this person's saying, what if you're still having symptoms on day 10 and your antigen test is still positive? Can you go back to work with a mask?
Yeah, I think in that case, if you're still have the key rule of that 5 and 5 days is that you're much improved or don't have any symptoms. If you're still having symptoms at day 10, that suggests that you're having probably a longer course of having a COVID illness, and I probably would not recommend you to go to work.
This person says, if you've tested positive for COVID, are there any over-the-counter medications that can ease your symptoms?
I think it really depends on which symptoms you have, but yes, I think a lot of over-the-counter medicines that you would take for a cold would also work for some of the symptoms that you have for COVID-19 as well.
For like the aches and the pains and the runny nose and the cough and that kind of thing, like what you would normally take?
Yeah, so I think definitely you can do some of the like either Tylenol or ibuprofen if you're having fevers or body aches. So, depending if you have nasal congestion, some of the medications that you can find over the counter can help with that too. It just depends on what symptoms you're maybe having to treat.
All right, and this last question, we've got about a minute left. If you were exposed today to someone who had COVID, but you've had all your shots, what should you do today?
So today, I still would wear a mask, and protect yourself.
And we get your questions answered. If you missed any of this information, you can find it on our website, WFMYnews2.com.